Order. Dan Carden to move the motion.
Thank you, Ms Butler. I appreciate your chairing of this debate. And I'm also grateful for having secured the time today to talk about an issue that has touched thousands of people and left a lasting trauma, I think, across our country. Can I start by giving thanks to the extraordinary campaigners, from Rights for Residents, John's Campaign, Care Rights UK and others, some of whom are with us today in the public gallery. And can I mention Diane, Jenny and Julia in particular, who have supported me throughout my work on this issue. Their tireless advocacy, often fueled by personal grief, has sustained a powerful call for change. I'd also like to thank everyone who's contacted me ahead of today's debate to share their stories. I can't name them all, but that together they form a mosaic of heartbreak and of courage. Their voices are the reason we're here today, and I will do my best to honour them. There are moments in our national life that leave deep scars. One of the most painful of these, still raw for so many, was the enforced separation of families during the COVID-19 pandemic. In care settings across the country, people were cut off from those they love for hours, days, weeks, months, for some until the very end. Families are still living with the trauma of that separation.
Would my order bring it away?
I will.
Thank you for giving way. One of my constituents, Tracy, came to speak with me in one of my advice surgeries. Her mum, Doreen, was one of those individuals you're talking about so well here in terms of being in a care home during the COVID pandemic and being cut off from a lot of contact. Now, she really suffered as a result of this. Now, would you agree, would the honourable member agree, that it's really important that these stories are heard as next steps are considered on this issue?
Thank you, and I'm sure your constituents, as I am, will be really grateful that you have come here today to add your voice to this campaign. As I said, families are still living with the trauma of that separation, and yet even now, as I'll come on to later, people in care settings are still being denied essential human contact. We all understood in those early days the need for swift and serious measures to protect public health. But not enough was done to balance the need against the harm of isolation on mental health and well-being. Somewhere along the way, something vital was lost: the right to connection, the right to love, the right not to die alone. Let's remember what that meant in real human terms. Elderly people confined to their rooms in care homes, with no familiar face and no hand to hold. Sick and disabled people denied a trusted advocate when they needed them most. Val wrote to me ahead of this debate. She told me how she was forced to watch her mother's health decline through the pane of a glass window. Her mother lost weight. She lost the ability to walk, to feed herself. In time, she became deeply depressed and withdrawn. And yet, when visits were allowed once again, Val saw a transformation. With regular contact, with care and love from a family member, her mother began to return to herself. And Val told me it wasn't the dementia or COVID that got her, it was loneliness, isolation and abandonment. Gemma also shared her story. She described how her mother was kept in solitary confinement-like conditions. When Gemma's mum's partner died, suddenly, she had to break the news over a stuttering video call with no family there to comfort her mother as the grief landed. These stories represent a pattern of suffering that should never have been allowed and must never be repeated.
I thank my honourable friend for giving way, and I'd just like to briefly mention the case of the Priestman family in my constituency. Paul Priestman, a military veteran, suffered from a stroke in 2019 and now requires care. However, this is being provided in a care home in Rochdale, many miles from their family home, and the family have serious concerns about the quality of Paul's care, but find they are routinely ignored by the care home in question. Doesn't the stories that he advocates and this whole debate show that too often rather than families being viewed as essential to the well-being of the person in care, they are often dismissed, ignored or thought of as an afterthought by care providers.
I'm grateful to my honourable friend, and he grasps the seriousness of this issue totally, and it's why campaigners are campaigning and fighting for a legal right to maintain contact Gloria's law. It would put into law the right to at least one care supporter, a trusted loved one, to provide support and advocacy in all health and care settings, so no one is ever alone when they need help the most. The campaign is supported by cross-party MPs, over 100 organisations, including COVID-bereaved groups from all 4 UK nations, charities, disabled rights groups and bodies such as the National Care Forum. In response to this pressure, the previous government amended Care Quality Commission regulations to make facilitating visits part of the fundamental standard of care. And I would like to pay tribute to the member for Faversham and Mid-Kent who steered that through government in the last Parliament. The newly inserted Regulation 9A requires that in-person visiting in care homes, hospitals and hospices and accompaniment to appointments always be facilitated by providers in line with people's needs and preferences. Only in exceptional circumstances should this be restricted. While this is a welcome step forward, it has fallen short. Just like the guidance that preceded it, Regulation 9A lacks clarity, oversight and accountability, and in practice it is too often misunderstood, misapplied or outright ignored. This past winter, Rights for Residents received hundreds of calls from distressed families who were blocked from seeing their loved ones. Outbreaks of flu or norovirus were being used as justification to deny all access. In some cases, for over 2 weeks, despite Regulation 9A being in place. To give just a couple of examples, Tina's mother, who has dementia, was in hospital being treated for pneumonia when a blanket visiting ban was imposed due to an outbreak of norovirus. It took days of trying before Tina received any update on her mother's welfare. Days later, she received a voicemail, her mum's frail voice whispering, "Don't give up on me, Tina." Her mental and physical condition deteriorated rapidly during this time, which Tina believes was exacerbated by their separation. Amanda's mother, who lost mobility after a brain hemorrhage, depends on family support for personal care and emotional well-being. But during another blanket ban, Amanda, despite quoting Regulation 9A, was told that her mother's right to contact was not worth the risk. By the time visits resumed, her mother had lost weight and become visibly withdrawn. Many similar experiences have been reported to Care Rights UK's advice line from people denied access to their friends and family, including when the care provider was aware of Regulation 9A but still chose not to comply with it. For example, they recently supported someone living with dementia who had had their visits stopped as part of a settling-in process in their care home. The provider failed to recognise the importance of maintaining support from familiar loved ones as a key part of dementia care. To understand the scale of the problem, Rights for Residents ran a national survey between February and May this year. The results are deeply concerning. 4 in 10 respondents had never even heard of Regulation 9A. 1 in 4 reported care settings implementing complete visiting bans since April 2024. Even when family members were aware of and cited Regulation 9A, in over a third of cases this had no effect on visiting arrangements. And many care settings continue to regard Regulation 9A as guidance only, which can be ignored without consequence. As Rights for Residents put it, these findings indicate that the introduction of CQC Regulation 9A has not been effective or sufficient in upholding the visiting rights of those using health and care settings, and that as a result, people are experiencing avoidable harm from unnecessary visiting bans. The conclusion is clear. Without a clearly defined legal right to maintain contact, access will continue to be patchy, precarious, and far too easy to deny. The postcode lottery of uneven implementation was unacceptable during the pandemic, and it's unacceptable now. And I want to stress that this is not about unlimited access. Care supporters would be subject to the same appropriate safety precautions as staff. It's about protecting the principle that the connection with loved ones is not an optional extra. It's essential to dignified care. No member of staff, no matter how professional or compassionate, can replace the bond between a parent and a child, a husband and a wife, a brother and a sister, or a lifelong friend and partner. And loved ones are more than companions. They are vital safeguards. They are the eyes and ears that notice what others might miss. They protect against neglect, spot subtle signs of distress, and speak up when something isn't right. To leave this matter to the discretion of individual managers without clear legal underpinning is to leave the most vulnerable at the mercy of arbitrary decisions, which could severely impact their well-being. It's not only a matter of compassion, it's a matter of rights. We all have a right to a family life. That right should not disappear behind locked doors when someone requires care. That's why we're calling on the government to guarantee the right of every person in a care setting to have at least one essential care supporter. Not just guidance, not tinkering around the edges of regulation, but a right protected in law. During the last general election, my party, the Labour Party, promised to make this change in government. That promise must now be delivered. It said, we will guarantee the rights of those in residential care to be able to see their families. Well, the only way to guarantee this right is through the law. The review of Regulation 9A is due shortly, and from the 30th of June to the 31st of July, the COVID inquiry will hear evidence on experiences of the care sector during the pandemic. As families relive the trauma of that period, the government has the opportunity to show them that they have been heard, that lessons have been learned, and that action will follow. If we truly believe in dignity, in compassion, in care, then this cannot be delayed any further. We owe it to every family torn apart. We owe it to every patient or resident still facing the risk of being isolated. And we owe it to every one of our constituents who fears that, when the time comes, they too might be left without a loved one's hand to hold. This change will cost the government nothing, but for those it protects, it means everything. Thank you.
The question is that this House has considered the right to maintain contact in care settings. Liz Saville-Roberts.
Diolch yn fawr iawn, Cadeirydd, and I'm very glad to see you, Cadeirydd, in your seat. And I am deeply grateful to the Honourable Member for Liverpool Walton for bringing this debate forward. And he will be aware that this is a hugely important topic for many of us. It's something that we have, many of us who lived through the COVID pandemic and the experiences we had with our families then, it's something that doesn't fade into the past. And that is what I want to talk about today. Because, of course, the visiting restrictions then threw a harsh focus on the issue. For example, between the 2nd of April 2020 and 22nd of July 2020, UK government guidance advised against all visits to care homes except in exceptional circumstances, such as end of life. End of life. It's what happens before that matters too, doesn't it? And I think we need to know what these exceptional circumstances may be in the regulations, because there's obviously room for definition of that. But fundamentally, we need a clarification on a legal right. And we need to learn from that time. Following the experiences of many families during the pandemic, more and more voices have been raised to call out the inconsistency with which vulnerable or cognitively impaired adults are treated when compared with the rights of children to be supported by their parents in health and care settings. And of course, it's entirely right that children maintain contact with their parents. We would rightly be appalled if this was denied. But somehow the social needs for love and family contact can be regarded as a luxury, a nice to have, but ultimately expendable for adults in certain circumstances. So a clear case emerged at the time for the government to support the same rights for families and carers of dementia sufferers as the parents of sick children, and allow for family representatives to stay with the patients at any time of the day, and for their role as carers to be recognised and accommodated. And it's recognised that changes in environment for people with dementia, such as going into hospital or moving into care, can cause immense challenges. Just think about it. All familiar things and all familiar routines are left behind. And it is the routine of the institution that takes over. What is most convenient for the institution is inevitably the priority. We talk about putting the patient first, but we know how flimsy those words are when health and care institutions feel threatened, liable, or are under staffing pressures. I would indeed.
I'm grateful that she's raising an issue that I think I didn't touch upon, and that's that good institutions, good care homes, will want the involvement of families and will not use blanket bans, will not try to prevent family members being part of the care of their residents. And so actually the worry is that it's the most vulnerable in perhaps the worst run care settings that are most at risk.
Indeed, this is exactly a point. I think the potential of the real good that family carers could do for health and care settings when they're well run, not be regarded as a nuisance to be fitted in, but actually complement excellent services when they are found. So, of course, care and nursing homes operate under a number of constraints, financial and regulatory pressures especially. And exactly, while many are excellent, they're shining beacons of humanity and kindness who provide a welcoming home. And remember, this is the place where people who live, a home for the people who live within their walls. Others do not. MPs will almost certainly have been approached by family members who are extremely reluctant to raise questions about the care of a loved one in a home because they are afraid that those people will be evicted from their home, because that is what the care home owners and managers can do. So it is our role here to be raising those concerns, to be their voices. And of course, I pay tribute to the many pressure groups and charities that have drawn attention to this issue, among them John's campaign, Rights for Residents, Care Rights UK, and the Relative and Residents Association. And I am personally immensely grateful to Julia Jones of John's campaign and dementia nurse Delith Thomas for their advice after my mother Nancy's stroke at Christmas 2020 and her final death from dementia a year later. I'd just like to read a tiny bit that I wrote at the time. Many of the key workers with whom we interacted over those 12 months were extraordinary. We have been beyond lucky to have dealt with a number of nurses, doctors and care workers who had the confidence and humanity to keep to the spirit and not the letter of official edicts. Even so, I touched my mother's hand only once during the critical 6 weeks after her first stroke. There were no hugs. Health authority infection policy vetoed family bonds of love as a health hazard to be minimised. At the same time, she had hearing aids. We could only speak to her through the window. The batteries were not replaced. She could hear nothing. And we know how important that is too, that hearing is for reducing the effects of dementia. Ysbyty Gwynedd and Ysbyty Bryn-Berel, that's the district hospital and the local community hospital, were signed up to John's campaign. And this enabled me to be recognised as my mother's carer. If only I had known this months earlier, although of course I bear in mind that this was during the COVID period. But people need to know their rights. Indeed, at one stage in early 2022, the staff at the community hospital asked me to come in specifically to help take pressure off nurses because there was a COVID outbreak. I contributed as a carer. I had a role to play. As a family carer, I helped that hospital. I was required to take COVID measures, tests and vaccination, exactly as were expected of staff members. Now, this is completely feasible for identified family carers alongside salary carers. This is an option for us. Family members as recognised and respected carers can be a real source of help for both hospital and care settings if only we can tease apart the web of fear of liability and, in honesty, a culture that presumes that the human needs of adults with cognitive impairments are limited to food and shelter and a screen in the corner of the room whenever an emergency threatens the organisation that holds their lives in its hands. We are social creatures. Deny us social contact, and we are damaged. So to close, we need to recognise this as a human right. Regulations expected to be facilitated in undefined emergency circumstances are evidently failing. I am so glad that this is in the Labour Party's manifesto for the last general election. It is in my party's manifesto in Plaid Cymru. Obviously, health and social care are devolved, but this is a human right. And that is not devolved, that is a reserve power. So I hope now that we have learnt the lessons of COVID and we move ahead and make this, we legislate to make this a human right. Thank you very much.
Thank you. Jim Shannon.
Thank you, Madam Chair, and thank you as well for filling in or bridging the gap when called upon, and for enabling this debate to go ahead. First of all, can I thank the honourable gentleman for Liverpool Walton for leading today's debate, and I'm a strong advocate for stability and comfort for young children, but I want to focus upon young children if I can today, and those unfortunately in care settings. And I believe it's so important that we do what we can to make their journey through the stage of their lives as secure as possible. So it is great to be here to do that. The honourable lady who spoke before me, I commend her for her comments, and she cast her minds all back to COVID and different circumstances, different times, different regulations, new ways or more controlled ways of doing it. But it didn't mean with the COVID regulations, which we don't criticise, by the way, because they're important to have in place. But the fact was, many people were unable to visit their loved ones, unable to have that last few minutes with those who were very much part of their lives, and find themselves in a position where, as in case of my mother-in-law, who passed away at the Ulster Hospital on her own. The point I'm making, Madam Chair, sometimes circumstances take you out of a sphere of what you wish to do and what you would like to do, and that was one of them circumstances. I want to give, if I can, a Northern Ireland perspective for this debate. I always do these things. The ministers in our place, and I know the ministers are always very keen to respond and try to help us when we put forward our suggestions to what needs to be done, perhaps. But as of 31st of March 2024, almost 4,000 children and young people were in care in Northern Ireland. And I want to focus on that, if I can, how important it is to get it right for them. This was the highest number ever recorded since the introduction of the Children in Northern Ireland Order of 1995. So it does give us a perspective of society, a perspective, I believe, of young people in particular in Northern Ireland who are under terrible pressure. And the figures, really, Madam Chair, are absolutely shocking. We must remember that there are so many circumstances which can warrant a child being put into care. Contact within the care settings is important to preserve the emotional bonds, the social interaction, the friendship that biological siblings have together. And although they might fight the bit out, the fact of the matter is there's not a greater love than there is between a brother and a sister, or brother, sister, whatever it may be. Being removed from a familial setting and placed in a strange and unfamiliar one can be damaging to a child's cognitive health. Showing why contact is so important for mental stability. Not a worrying trend from Northern Ireland, Madam Chair, as well, is the fact of the numbers of those with mental health at an early, as young as 8-year-old. My goodness, can you visualise that? 8-year-old, when you're young, you're innocent, and yet the pressures upon an 8-year-old are so great. That's what's happening in Northern Ireland. That's why the numbers are so large. Not only this, Madam Chair, but consistent contact has been proven to achieve better long-term outcome for families and assist with their transition back to a family dynamic. I know the Minister is always very keen to respond to our queries, and I know I will ask this question, that what chance and what opportunity has the Honourable Lady the Minister had to contact the relevant Minister in Northern Ireland, for instance, to ascertain what exchange of ideas or policies or strategies or new ideas perhaps to help better and to ensure that they can transition back to a family dynamic. which is where it's got to be always if at all possible. We live in a fractured society, Madam Chair. We live in a society where life isn't just the same as it was whenever I was a wee boy. When I was a wee boy, I don't think there's anybody in this chamber probably as old as me, with maybe one exception perhaps. But the point I'm making is this: society, as I remember it, was so different when I was young, and today it's even more challenging. Not only for parents, Madam Chair, as well, I think it's imperative that sibling contact is looked at and furthermore encouraged in terms of creating a sense of normality in care. It's not all about the regime, it's not all about the rules, it's not all about the conditions of being there. It's about a relationship between the siblings and how they can have some normality. An Ofsted study showed that 86% of children in care thought it was important to keep siblings together. That's the young children themselves. I believe that in my heart. It's really important. Not always possible, Madam Chair, but I think we should strive by all means within our power to ensure that children can keep in touch with their siblings. But the reality is that this is often not the case, and many siblings had and remain with minimal contact, which is terribly sad when those who were part of the family unit are suddenly maybe hundreds of miles away. Nobody's fault, I would suspect, but if it's possible to keep them together, we should. For example, Madam Chair, for siblings who potentially come from abusive households, and I have to say that sometimes those are the ones that I would be aware of as an MP, shared experiences can create a more positive healing journey. And I fear that if the same situation continues without any stops or changes being done to it, it will hinder the healing process for young children, and then will put them in a position whenever they grow up one day to be parents themselves. The things that have happened to them in the past will focus or make them focus upon bringing their children up in a certain way as well. So let's get it right today for the children, the parents of tomorrow. To conclude, Madam Chair, I'm a supporter of contact. Very much recognise that the Honourable Gentleman has put in his contribution to start this debate. And I hope we can do more to prioritise the maintenance of it for young children, their parents, their siblings and the extended families. It is crucial for their mental and emotional well-being, and ensured familiarity can go above and beyond in supporting transitions. There is no doubt that care settings can be incredibly challenging environments for some children. They're never easy. So let's do what we can. I say that, I mean us collectively in this room today, and government, who particularly has the opportunity today to make the change and to make the process as stress-free as possible. And I look very much to the Minister, as I often do, for further engagement with devolved institutions. I already asked for that. If you can do that for me, I really appreciate it. To ensure that a stronger sibling contact can also be maintained. This debate is so important. Well done, the Honourable Gentleman, for bringing it forward. There might be a big number of people here today, Madam Chair, but that doesn't reflect on the seriousness or the importance of this debate. And for those of us who have some personal interest in this story, but also for those who, as MPs, as we all are, have an obligation to our constituents who have asked us to make sure these things are on record. I believe we have great responsibility as MPs. We have an opportunity to formulate law, an opportunity to support government and strategy, or amend the direction sometimes that government may go, to ensure that the young people, the children of today, the parents of tomorrow, have the ability to have a good life. And I think if we try to do that as MPs and as a government, and I believe we will be building a better society and a better place for everyone to live in. That's the ultimate goal I would have, Madam Chair. Ultimate goal I think we all have. It's a big challenge. Let's see if we can do it.
Yeah, thank you. Liberal Democrat spokesperson Alison Bennett.
Not too many.
Thank you, Ms Butler. It's very much appreciated that you've come to chair this important debate today. And I would like to start by thanking the Honourable Member for Liverpool Walton for bringing this really important debate. As the Honourable Member for Strangford just said, the number of people in this debate are not a reflection of how important it is. And I think that all Honourable Members who've contributed have spoken with real moral authority and have really reflected the gravity of what we're talking about today, namely the rights of some of the most vulnerable people in our society, those living in care homes, in hospitals and hospices, and their right to maintain contact and see their loved ones. Throughout the COVID-19 pandemic, thousands of people living in care settings in my constituency of Mid Sussex and across the country were forbidden from seeing those closest to them. This was especially devastating for residents living with conditions like dementia or severe memory loss, conditions that affect approximately 70% of care home residents. For these individuals, familiar faces are more than just comforting. They are essential to their sense of identity and stability. Imagine being cut off from the people you know best, who can calm you in moments of confusion and who understand your needs in ways no staff member possibly can. This is not an abstract issue. It is a painful reality that caused immeasurable harm during the pandemic. Even as the rest of the country began to reopen in 2022, care homes continued to impose harsh restrictions. Data shows that between April and September 2022, 10% of care homes permitted no visitors at all during COVID outbreaks. 20% confined residents to their rooms for up to 28 days, and nearly half maintained some form of visiting restrictions, even without any outbreak present. The impact of these policies was quite simply brutal. Vulnerable people in Mid-Sussex and across the country were left isolated and confused, their symptoms worsening without the emotional and practical support only loved ones can provide. I want to share a story that will be distressing to some, but I think it is worth sharing. Last week, I was horrified to watch a report on BBC South East about a 92-year-old gentleman, Donald Burgess, from East Sussex. Donald was a wheelchair user, having had one leg amputated. And on the 21st of June 2022, he was reportedly brandishing a knife in his wheelchair, having become irritable and confused. Care home staff failed to resolve the situation, and so the police were called. Donald was sprayed with pepper spray, hit with a baton, and tasered by police, all while still being in his wheelchair. Donald was taken to hospital as a result of those injuries, and he subsequently caught and died from COVID-19 a couple of weeks later. On the BBC South East News report last week, Donald's family were interviewed. Those family members only lived 10 minutes away from the care home that he was in. And they say that if they had been called, they would have been there, and they would have been able potentially to calm him and resolve the entire situation. It's beyond tragic that that happened, and that's how Donald's life came to an end. And given that I think honourable members in the room are not from the South East region as I am, that video of the attack on Donald is available to view, and reports are up online if any members are interested. So I want to take a moment to commend the tireless work of advocacy organisations such as the Relatives and Residents Association, Rights for Residents, Care Rights UK and John's Campaign. Their efforts have been instrumental in raising awareness and pushing for change. And I also commend the way the Honourable Member for Liverpool Walton has set out the case for the change that is required. The Government's recent introduction of Regulation 9A by the Care Quality Commission, a new fundamental standard on visiting and accompanying, is a welcome step forward. But while this regulation aims to ensure that care providers do not discourage visits and that people can attend medical appointments accompanied by a family member or advocate, it falls short of what is needed. Regulation 9A relies on enforcement by the CQC, an organisation that I think it is well understood is well stretched thin and faces a number of challenges. The CQC cannot prosecute providers for breaches of this and often lacks the resources for swift and consistent enforcement. And most importantly, this regulation does not create an enforceable right held by the individual resident themselves. This gap leaves residents and their families vulnerable. Without clear legal protections and a statutory right to visitation, we risk repeating the mistakes of the past. This is why my Liberal Democrat colleagues and I are calling on the Government to implement Gloria's Law without delay. Gloria's Law would enshrine in primary legislation the right for every person in a care or health setting to have at least one essential care supporter present, regardless of circumstances. As Rights for Residents say, only Gloria's law will guarantee that none of us will be forcibly separated from our loved ones again. I urge the Minister today to answer these important questions. Firstly, does she believe that Regulation 9A alone is sufficient to prevent isolation and ensure that residents can be supported in times of crisis or future public health emergencies? Secondly, is the Government confident that the CQC and the DHSC have the capacity, resources and real-time data systems in place to monitor visiting arrangements and act swiftly if restrictions become harmful? And thirdly, will the Government commit to going further by passing Gloria's law, guaranteeing a statutory right to unrestricted in-person support from at least one essential care supporter? Ms Butler, the lessons of the pandemic are clear. Families are not visitors. They are vital partners in supporting those we love through their most vulnerable moments. So let us act now and give vulnerable people the rights they need and deserve, and in doing so, perhaps save lives like Donald's. Thank you.
Thank you. Shadow Minister Caroline Johnson.
Thank you, Ms Butler. It's a pleasure to serve under chairmanship this morning, and I declare my interest as an NHS consultant. I know from my own professional experience that hospitals and other care settings can be distressing places for patients and their relatives. Even with our excellent NHS staff on hand, patients want more assurance and familiarity while they undergo care and treatment. And for many, this support comes from the family and friends visiting them during their hospital stay, while they're in a hospice, or while they're receiving care in a care home. And I do want, at the outset of this speech, to pay tribute to the very many excellent staff who work in these settings and provide care around the clock during public holidays and putting themselves out to care for others. And I also want to make the point that for those in care homes, it is just that. It's their home. And they should be entitled to have relatives to visit them and friends to visit them in the same way as they would in any other home that they lived in. You can also see that it improves care. An inability to visit one's relative in hospital leads to an increased feeling of not knowing how are they this morning. Are they getting worse? Are they getting better? Not knowing how if they're in pain, if they're comfortable, if they can reach what they need to get. The fear of not being able to help them. Worry about the relative being lonely or stressed because they're not able to be there to support them. This adds to stress for patients' relatives. And for the patient themselves or the person in the care home, they know that staff are busy and they may not want to bother them for small things, to reach their book or glasses, to pass them a drink so important for hydration, to help them eat a meal, to move the curtains so the sun's not in their eyes, to provide that extra blanket. And so many will wait hours instead for their relative to come. And sometimes, Madam Chair, they just want a cuddle. They just want to hold hands with the person that they love. Clearly, this is in their best interests for their health and their mental well-being. Relatives also know the person they're seeing the best, and they're able to identify changes in condition which may go unnoticed by staff. And, Madam Chair, I remember visiting a relative of mine who was getting better following surgery and was stepped down from HDU to the ward. And when I arrived, I realised he looked grey, pale, and unwell. He was indeed in shock, requiring urgent fluid resuscitation. What if that had not happened at the beginning of visiting time? I shudder to think. It was with these things in mind that the previous government introduced the Health and Social Care Act, or Regulated Activities Regulation 2014, and in particular Regulation 9A, and I pay tribute, as others have done, to my honourable friend, the member for Faversham and Mid-Kent, for doing so. The regulation was designed to ensure that patients staying in hospital or residential care settings could receive visitors in a fair and consistent way. It also aimed to ensure that care home residents would not face barriers or discouragement if they wanted to take their visits outside, and made provisions for those on non-residential hospital or hospice appointments to have guaranteed rights to accompanying friends or family members. But now that these regulations are in place, we need to ensure they're working effectively and that systems are in place to detect any attempts to water down or remove the rights that they provide. And one of the things I wanted to raise with the Minister is the exceptional circumstances limitation. Members will know that the regulations grant visiting rights unless there are exceptional circumstances. And the CQC guidance states that providers should base this assessment on the health, safety and welfare of people using the service or other people involved, and should consider the appropriate balance of a person's rights, the needs of people using the service, and any identified risks. If concerns have been raised about current levels of compliance with visiting regulations, we must begin by identifying how and why this caveat in the rules is being used. Can the Minister tell us what kinds of circumstances providers are deeming exceptional? Who is making these decisions and who is overseeing that process? The CQC guidance also states that where additional precautions or restrictions are needed, they should represent the most proportionate and least restrictive option available. Is the Minister confident this principle is being followed? And what is she doing to provide transparency for patients and their carers about decision making? In sum, can the Minister tell us how many times the exceptional circumstances provision has been used in the last year by each institution, and how many visits or accompanying visits have been blocked as a result of its use? Is she monitoring this? What steps is the Minister taking to ensure those with reduced mental capacity are having their rights to visits upheld? It's important that these rules are followed, and the very vast majority of care settings will be providing excellent care, but the concern is that the better care settings are more open, and as the Honourable Member for Devon, Mayor Neath said, actually it may be that sometimes that visiting time is restricted to cover up poor care, adding to the stress of both patient or resident and their carers. So this is important that the Minister works on what she can do to improve the education and training of staff and change the culture of settings so that everyone is able to get the visits they need. And some people are using the realms of infection control measures to exclude visitors. Now, I ask the Minister, surely if infection control measures are being used to restrict visiting on a frequent basis, that is a red flag that infection control measures within that institution are not providing adequate safety for residents. So what steps is the Minister taking to ensure staff are following the requirements given to them and make sure that individual providers are not being selective in their adherence to the rules? It's clear from what we've heard today that more needs to be done to make sure patients receive the visits and accompaniments they're entitled to. If we're serious about putting patients and residents first, more needs to be done to guarantee them the social and emotional support they need to be comfortable, as well as the best treatment or palliative medical care available. The CQC, as others have said, is not able to prosecute for breaches of Regulation 9A, though it can take regulations such as civil enforcement. Does the Minister believe that that is a strong enough incentive for providers to meet their obligations, or does she recognise that increased powers of enforcement may be needed to ensure that patients' rights are protected? What other schemes has the Department considered to help providers better facilitate contact and visiting arrangements? And I just want to finish with this, Madam Chair. I work as an NHS consultant paediatrician, and paediatrics, we always have open visiting for parents. And parents are really helpful in helping to provide the care and look after the children. It's a teamwork approach between parents and the staff. And I ask the Minister, so why would that not be available for people of all ages when they're at the most vulnerable? Because I can't see why it shouldn't be. Indeed, I think it would help quite dramatically.
Minister Ashley Dalton.
Thank you, Madam Chair, and thank you for chairing today's debate at such notice. And thank you to the member for Liverpool Walton for securing this really important debate. The Minister of State for Care has asked me to pass on his apologies for not being able to represent the government in this debate, as he is currently in session on the Mental Health Bill Committee. But joins me not only in thanking the Honourable Member for Liverpool Walton for securing this debate, but for all of the work that he's done in advocating for relatives and friends to have the right to visit care home residents and patients in hospitals and hospices. And thank you also to all of those who've shared their personal stories and those that have joined us in the gallery today. I can say without hesitation that the Minister for Care and I agree with the Honourable Member on the importance of visiting in care settings. Contact with family and friends is a crucial part of a person's care. Indeed, there is evidence that supporting people to be actively involved in their own care, treatment and support can improve outcomes and experiences for people receiving care. No one should be denied reasonable access to visitors when they're in a care home, a hospital or a hospice. And this includes receiving assistance from a care supporter or simply going for a walk with a family member or a friend. Before the COVID-19 pandemic, care homes, hospitals and hospices set visiting policies based on their specific local circumstances. During the pandemic, restrictions on visiting were implemented to prevent the spread of COVID-19. These restrictions were in response to clinical advice and were designed to protect people living in care or in hospital, who were often among the most vulnerable to the virus. Visiting and accompanying is one of the fundamental standards against which the Care Quality Commission assesses quality of care. The Government recognises how important visiting is for the health and well-being of residents in care homes and patients in hospitals and hospices. And we've monitored the position since the new fundamental standard was introduced in 2023. We know that the majority of health and care providers are facilitating visits and recognise its importance. The Capacity Tracker, a digital tool where adult social care providers self-report data, shows that 99.3% of care home providers are facilitating visits, and that figure has been stable since September 2022. However, we also know that there are times where it is necessary for movement in and out of care settings to be temporarily restricted. I will.
Do you have a definition of what constitutes as a visit in that circumstances? Would an hour's visit once a week count, or is there a specific time frame that's qualified?
I thank the Shadow Minister for her intervention. I don't have that data to hand, but I'll make sure that that is provided to her afterwards. As I was saying, whilst there are sometimes a need for temporary restrictions or modifications to minimise significant risks, the Government would very much hope that such instances are a rarity, and it is our aspiration to ensure that visiting policy and practice strike the best possible balance between individual well-being and public health needs. And I've been really moved and have taken note of the evidence put forward by so many people today that this may not always be the case. The Honourable Member for Devor May Rioneth talked about her own experience with her mother, and I thought really brought to life the value that family and friends bring not only to the emotional well-being of the person being cared for, but also as partners in care, and as playing a really key role in delivering that care. I will.
Very interested to hear that she was talking about visits previously, but I think the essence of what many of us have discussed today is that there is a role for family carers alongside salaried carers, and that we desperately urge the Government to find a way to bring that forward in law.
I thank you for that intervention, and it is noted. I think that the Honourable Member for Strangford spoke about a powerful story of his own mother-in-law and his experiences there, and also the importance of family contact specifically for children in health and social care settings. But for the sake of clarity, I would like to say that Regulation 9A does not cover children's homes. We are specifically talking about health and social care settings. There are other regulations for that. And we had powerful interventions from others, including the Honourable Member for Altrincham and Sale West. The Liberal Democrat spokesperson and the Shadow Minister asked a series of questions. Is Regulation 9A sufficient? Can the CQC monitor and act? What is the exceptional circumstances element of Regulation 9A, and who's making those decisions? What principle is being followed, and how is that being monitored properly? We are committed, the government is committed to understanding this current position and considering how it can improve. And that's why in April we launched a review of CQC Regulation 9A, visiting and accompanying care homes, hospitals and hospices. And all of the issues that have been raised today will be explored as part of that review. We want the review to be thorough, and we will consider the experiences of those receiving care, their families and loved ones, providers, health experts, as well as information from the Care Quality Commission, the Local Government and Social Care Ombudsman and the Parliamentary and Health Service Ombudsman. To ensure that we get a wide range of views, we have also opened a call for evidence, and we're running focus groups. The first one, Madam Chair, is taking place later today. And today's debate and the representations made here today also help inform this review. And I further thank all contributors today and can assure that your contributions have been noted. We're determined to understand whether the expectations set by the regulation and its application in practice works in the best possible way across care homes, hospitals and hospices, and in relation to both visiting and accompanying. I can confirm for the member of Strangford that we will also be looking at the experience in all of the other UK nations, including Northern Ireland and Scotland, where the Care Reform Bill, which includes Anne's Law, was approved on the 10th of June. And that law requires care providers to facilitate visits to care home residents and identify an essential care supporter for each resident. I can assure honourable members that we will reflect on the points made here today as we conduct this review. And I can also assure them that we'll look to move fast and also ensure we do justice to this important issue. We really need to understand the problems and gaps if we're to draw the right conclusions from this review. And we're pressing on with our evidence gathering and focus groups right now. And we plan to publish the outcome of this review and any further steps in the autumn. Thank you.
Dan Carden to wind up.
Thank you, Ms Butler, as has been said, for saving our debate, really, and getting here so quickly. And can I also finish by thanking the campaigners who have come here today, all members for participating, and for the Minister for her understanding and openness to receiving the evidence and understanding the experiences that people have had. I see this really as a matter of principle. Sometimes I think when the state and when we contract out services and provision, it oversteps the mark. We forget what really matters, which is that we want the love and care of our families and our the people closest to us, and that no bureaucrat or care home manager has the right to say, no, you cannot maintain contact with the people that you love. I think this is something that the law needs to put right, and that if it can be done, it will be to the benefit of all, to the families, to the people needing care, and to the institutions providing that care too. And I hope the Minister, alongside the Minister of Care, will keep an open mind moving forwards. Thank you.
Thank you. The question is that this House has considered the right to maintain contact in care settings. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order, order. Sitting suspended until 11 a.m.